What if I told you that your blood test came back normal and you still had a serious deficiency that was quietly damaging your nervous system? That's not a hypothetical. It's happening to millions of people right now. There is one nutrient whose deficiency is so commonly missed, so routinely misdiagnosed, and whose consequences are so serious, including potentially irreversible neurological damage, that I consider it one of the most underappreciated health threats of our time. And the reason most people don't know they have a problem? The standard reference ranges used in blood tests are, in my view, set far too low. You can receive a normal result and still be heading toward nerve damage, cognitive decline, and cardiovascular disease. Today, I'm going to show you exactly what this deficiency looks like, who is most at risk, what the numbers actually mean, and how to fix it. I'm James Mercer, and welcome to the Longevity Tip. In this video, you're going to learn the full picture of vitamin B12 deficiency, from the earliest symptoms to the most serious complications. You'll understand why the standard normal range on your blood test may be dangerously misleading. You'll learn who is most at risk, and you'll get a clear, evidence-based framework for testing, diet, and supplementation. Let's get into it. When most people hear vitamin B12 deficiency, they think of one thing, anemia. And they're right, but only partially, because anemia is just the beginning of what B12 deficiency does to your body, and in many ways, it's the less serious half of the problem. Vitamin B12 is essential for the production of red blood cells. Without adequate B12, your body produces red blood cells that are structurally abnormal. They're oversized, misshapen, and fragile. This is called megaloblastic anemia, and it has cascading consequences throughout your entire body. The core problem is oxygen delivery. Red blood cells carry oxygen from your lungs to every cell in your body. Damaged, oversized red blood cells are less efficient at this job, and they don't survive as long as healthy ones. The result? Your cells become chronically oxygen deprived. Your heart starts beating faster, trying to pump more blood to compensate for reduced oxygen delivery. This is called tachycardia. You may feel your heart pounding during activities that previously required no effort. You feel exhausted, not the normal tiredness that sleep resolves, but a deep, persistent fatigue that's present even after a full night's rest. People with B12 deficiency describe feeling like the air has been let out of them. Basic activities, grocery shopping, cleaning, walking the dog, leave them depleted. Shortness of breath appears during physical activity because your oxygen delivery system is compromised. Your skin becomes pale, sometimes with a subtle yellowish tint. The pallor is most visible around the mouth, lips, and the whites of the eyes. Headaches and dizziness occur because your brain is being deprived of adequate oxygen supply. Concentration and focus deteriorate. People describe feeling scattered, unable to hold a train of thought, mentally slow, and there is one symptom that is particularly specific to B12 deficiency. The tongue becomes smooth and shiny. Its normal texture, the small projections called papillae, gradually disappear due to inflammation. This is called atrophic glossitis. It can be accompanied by burning, pain, and in some cases ulcers. Every one of these symptoms, and the fatigue, the racing heart, the dizziness, the pale skin, the smooth tongue, tells the same story. Your cells are starving for oxygen because your red blood cells can no longer do their job properly, but it's the second half of B12 deficiency that makes this nutrient truly critical. Here is what most people, and unfortunately many doctors, don't fully appreciate about B12 deficiency. The neurological damage it causes can be permanent, not difficult to reverse, not takes a long time to heal. In some cases, if B12 deficiency is allowed to progress far enough, the nerve damage is irreversible. This is what makes it categorically more serious than iron deficiency anemia, which is fully reversible with treatment. Vitamin B12 is essential for building and maintaining myelin, the protective sheath that surrounds and insulates your nerve fibers. Think of myelin as the insulation around an electrical cable. Without it, signals traveling along your nerves become distorted, slowed, or lost entirely. When B12 levels fall too low, myelin breaks down, and what follows is a progressive deterioration of neurological function that can affect virtually every system your nervous system controls. The first symptoms are typically sensory: tingling, burning, and numbness in the hands and feet, what doctors call peripheral neuropathy, are often the earliest neurological signs of B12 deficiency. Many people dismiss this as poor circulation or sitting in the wrong position, but when it's persistent, symmetrical, and present in both hands or both feet, it deserves serious attention. A characteristic tingling at the tips of the toes is sometimes the very first neurological symptom to appear. As deficiency progresses, more serious symptoms emerge: loss of sensation, reduced ability to feel touch, temperature, or pain in the extremities, muscle weakness in the legs and arms, making climbing stairs, carrying objects, or fine motor tasks increasingly difficult, balance and coordination problems, an unsteady gait, difficulty walking in a straight line, increased risk of falls. There is one symptom that is highly specific to B12 deficiency and worth knowing by name: Lermit's sign. When the head is tilted forward, simply bending the chin toward the chest, a sharp electric sensation runs down the spine. Patients describe it as a feeling of electricity traveling down their back. Beyond the peripheral nervous system, B12 deficiency can cause bladder dysfunction, a loss of the urge to urinate even when the bladder is full, erectile dysfunction in men, gradual deterioration of vision and hearing. B12 deficiency can cause what is called secondary dementia, a progressive decline in cognitive function, including memory loss, difficulty thinking clearly, and reduced mental sharpness. This is critically important. Secondary dementia caused by B12 deficiency is potentially reversible if caught and treated early. Many people who receive diagnoses of cognitive decline have never had their B12 levels properly assessed. There is also the psychiatric dimension, which is perhaps the most surprising aspect of this deficiency. B12 deficiency can produce anxiety, depression, mood disturbances, personality changes, hallucinations, and in severe cases, psychotic disorders. These are a direct consequence of neurological dysfunction, not a separate psychological problem. Finally, when changing position from lying down to sitting or standing, some people with B12 deficiency experience a sudden drop in blood pressure, causing the visual disturbance known as seeing stars. This is called orthostatic hypotension. The neurological picture of B12 deficiency is wide, varied, and serious. Tingling extremities, balance problems, cognitive decline, depression, bladder issues. These are all expressions of the same underlying problem: myelin breaking down because B12 is absent. The earlier this is caught, the better the outcome. Once nerve damage becomes severe, recovery is not guaranteed. There is a third dimension of B12 deficiency that receives far less attention than it deserves, and it has nothing to do with anemia or nerve damage directly. It has to do with your heart. Vitamin B12 plays a critical role in a biochemical process that converts a compound called homocysteine into other harmless substances. Homocysteine is an amino acid that your body produces naturally during normal metabolic processes. When B12 is insufficient, this conversion process breaks down, homocysteine accumulates in the blood, and elevated homocysteine is one of the most well-established risk factors for cardiovascular disease. Homocysteine is directly atherogenic, meaning it actively promotes the formation of plaque in your arteries. It damages the inner lining of blood vessels, triggers inflammation, and accelerates the development of atherosclerosis. Elevated homocysteine is independently associated with significantly increased risk of heart attack and stroke, separate from and compounding the effects of elevated cholesterol and blood pressure. The insidious part: you can have normal cholesterol levels, normal blood pressure, and still be accumulating arterial damage because of elevated homocysteine driven by unrecognized B12 deficiency. This is the third reason B12 deficiency is more consequential than most people realize. It's not just anemia, it's not just nerve damage, it's also a silent driver of cardiovascular disease. operating through a mechanism that most routine blood panels don't even check unless you ask specifically for it. B12 deficiency is not evenly distributed. Certain groups face dramatically elevated risk, and many of them don't know it. The most straightforward risk factor is diet. Vitamin B12 is found almost exclusively in animal products: red meat, organ meats, particularly beef and chicken liver, fish, seafood, eggs, and dairy products, including yogurt, kefir, and aged cheese. Plant foods do not contain meaningful amounts of active B12. There is a common misconception that the bacteria in our intestines produce enough B12 to meet our needs. While gut bacteria do produce B12, they produce it in the large intestine, and absorption of B12 occurs in the small intestine, which comes earlier in the digestive tract. The body cannot move B12 backward from the large intestine to the small intestine for absorption, so the B12 produced by gut bacteria is almost entirely unavailable to us. This means that people following vegan or strict vegetarian diets are at very high risk of B12 deficiency unless they are actively supplementing. Age is a second major risk factor. After age 50, the stomach naturally produces less hydrochloric acid. Stomach acid is essential for releasing B12 from the proteins in food. Without adequate acid, dietary B12 cannot be properly extracted and absorbed, even if the diet is rich in animal products. Medications are a third, frequently overlooked risk factor. Metformin, the most commonly prescribed medication for type 2 diabetes, is known to impair B12 absorption, particularly with long-term use. People taking metformin should have their B12 levels monitored regularly. Proton pump inhibitors, medications used for acid reflux and heartburn, sold under names like omeprazole and pantoprazole, reduce stomach acid production, which reduces B12 absorption from food. These medications are among the most widely prescribed in the world, and many people take them for years without considering their effect on B12 status. Other risk factors include inflammatory bowel conditions like Crohn's disease and celiac disease, chronic heavy alcohol consumption, long-term use of oral contraceptives, chronic pancreatitis, and parasitic infections. If you fall into any of these categories, vegan or vegetarian diet over 50, taking metformin or proton pump inhibitors, history of digestive conditions, heavy alcohol use, B12 testing should be a priority, not a consideration, a priority. The risk is high, the consequences are serious, and the fix is straightforward once you know you have a problem. This is where the standard approach to B12 testing falls short in ways that matter enormously, and understanding this could change how you interpret your own blood results. The standard reference range for serum B12 is typically listed as 200 to 1,300 picograms per milliliter. If your result falls anywhere in this range, most labs and many physicians will tell you your B12 is normal. The problem, this range is very likely set too low. Research increasingly suggests that neurological symptoms of B12 deficiency can occur at levels of 300 to 400 picograms per milliliter, levels that fall squarely within the normal range on standard tests. Hidden B12 deficiency that is producing real biological damage, can be present even when the serum B12 result appears normal. Based on the research literature, the minimum B12 level worth aiming for is 400 picograms per milliliter. Optimally, the evidence supports targeting 800 to 900 picograms per milliliter for robust neurological protection. There is a second problem with standard B12 testing. Serum B12 measures total B12 in the blood, including forms that are bound to proteins and biologically inactive. It does not fully reflect how much B12 is actually available to your cells. This is why additional tests can be valuable when serum B12 is borderline or when symptoms are present. Hollow transcobalamin, sometimes called active B12, measures only the fraction of B12 that is actually available for cellular use. This test can detect deficiency at an earlier stage than standard serum B12. It is worth requesting if your serum B12 is in the 300 to 400 range. Homocysteine rises when B12 is insufficient. An elevated homocysteine level is an indirect but meaningful signal of functional B12 deficiency. It is also an independent cardiovascular risk marker worth knowing regardless. Methylmalonic acid is another sensitive marker of B12 deficiency at the tissue level. It is highly specific for B12 deficiency. A standard complete blood count can provide supporting evidence. Elevated MCV, the average size of red blood cells, suggests megaloblastic changes consistent with B12 deficiency. Reduced hemoglobin, white blood cell count, and platelets can also appear. One important caveat: anemia is not always present in B12 deficiency. Many people have neurological symptoms without any anemia. A normal blood count does not rule out B12 deficiency. The key takeaway: a normal B12 result on a standard blood test is not the final word. If you have symptoms, if you are in a high-risk group, if your level is in the 300 to 400 range, request additional testing. Ask specifically for holotranscobalamin or homocysteine. Your standard panel is a starting point, not a complete picture. The good news about B12 deficiency, once you've identified it, is that the solutions are clear, evidence-based, and accessible. The first line of defense is diet. The best dietary sources of B12 are beef liver, chicken liver, red meat, poultry, herring, rainbow trout, salmon, eggs, natural yogurt, kefir, and aged cheese. Regular consumption of these foods provides substantial B12 for most people with intact absorption. Plant foods do not contain meaningful active B12. Chlorella, a type of green algae, contains some B12, but in variable and generally small amounts. Spirulina, despite its health reputation, contains primarily what is called pseudo-B12, a structurally similar compound that is biologically inactive in humans. It does not prevent or treat B12 deficiency. For people who cannot meet their needs through diet, whether due to dietary restriction, age-related absorption issues, or medication interference, supplementation is necessary and safe. The current official recommendation is 2.4 micrograms per day. However, growing evidence suggests this is set too low, with experts increasingly recommending closer to 6 micrograms per day for healthy maintenance. For people with confirmed deficiency or levels below 350 picograms per milliliter, therapeutic supplementation of 500 to 1,000 micrograms per day is typically recommended, split into multiple smaller doses throughout the day to optimize absorption. Once optimal levels are achieved, a maintenance dose of 100 to 200 micrograms per day is generally sufficient. There is no known risk of B12 toxicity. The body excretes what it doesn't use. This is not a nutrient you can meaningfully overdose on. Regarding which form of B12 to take, there is ongoing debate about methylcobalamin versus cyanocobalamin. Despite what you may read in wellness circles, current evidence does not strongly favor one form over the other for most people. Both are effective. Whether you take a capsule or a sublingual tablet also appears to make little practical difference for most individuals. For people who cannot absorb B12 through the gut due to severe absorption disorders, intramuscular injections are an option. These should always be administered by a healthcare professional as they carry a small risk of anaphylactic reaction. B12 deficiency is one of the most correctable, serious health problems that exists. The testing is available. The dietary sources are well established. The supplementation is safe, inexpensive, and effective. What it requires is awareness, knowing to look for it, knowing how to interpret the results, and knowing when the standard approach isn't telling the whole story. Vitamin B12 deficiency can produce anemia, progressive nerve damage, cognitive decline, psychiatric symptoms, and elevated cardiovascular risk, all while your standard blood test shows a result labeled normal. The warning signs span your entire body: fatigue that sleep doesn't fix, tingling in the hands and feet, balance problems, mental fog, depression, a smooth burning tongue, a racing heart. The risk groups are large and often unaware: vegans and vegetarians, anyone over 50, people taking metformin or proton pump inhibitors, anyone with a history of digestive conditions, and the solutions, once you know what you're dealing with, are straightforward. If you haven't had your B12 levels checked recently, that's the starting point. And if you have been checked and told your levels are normal, remember what you learned today about what normal actually means. If you found this useful, leave a like and subscribe to the Longevity Tip. It helps more people find this kind of content. I'm James Mercer. I'll see you in the next one.